Worldwide back pain is the single leading cause of disability, preventing many people from engaging in work as well as other everyday activities. Back pain is one of the most common reasons for missed work. Now there is hope with minimal invasive surgery.
I've always been interested in the human body, and I always wanted to help people, and I enjoy using my hands. My dad was a builder, and growing up, I was around a lot of tools that orthopedic surgeons, there's a lot of similarities between the tools that a builder uses and actually orthopedic surgeons use, and it ended up being a perfect fit for me.
Not every patient with back pain needs to have an operation.
Most back pain can be treated conservatively. 90% of the patients that come in and see us are treated conservatively. When we talk about spine surgery, we talk about not only larger spine surgeries, but more minimally invasive spine surgeries. And I think that's a good topic to discuss today. When we talk about minimally invasive spine surgery, most patients will reference laser surgery. And I explain to the patients that laser spine surgery, it's clever marketing, it's clever advertising. And what really that they're discussing is minimally invasive spine surgery, which we do right here at Rhode Island at University Orthopedics. And that surgery is basically, it's a smaller incision. It's less soft tissue injury, so it's less injury to the nerves, the muscles, the tendons, and ultimately it leads to a quicker recovery. One thing to take into account is even larger spine surgeries, we now do minimally invasive. We limit our incisions, and it ultimately, again, leads to a quicker recovery. But for a true minimally invasive spine surgery procedure, it's usually out of the hospital the next day, or many times they're in and out of the hospital the same day. And those patients are usually patients that continue to have chronic pain from spinal stenosis, from a disc herniation causing sciatic pain down their leg or a pinched nerve in their neck. Most patients that present to me with pain, and whether they have surgery or they don't have surgery, they basically come to me because it has disrupted their life. They're not able to do their daily routines. They're not able to go to work. They're not able to care for their kids. And usually that's the point that is a tipping point that brings them to the physician.
Minimally invasive spine surgery is about an hour and a half.
Patients come in with back pain, patients come in with nerve pain, that sciatic type pain, and that pain is just, it's tremendous. I have many patients, many female patients that say they'd rather give birth than to have this sciatic nerve pain. And when they have relief for that pain after the surgery, it's rewarding for us to see the patient so happy and be able to return to normal life.
Wow, so for those who have been suffering with back pain, this type of surgery can be life-changing. We'll make sure we post details on how to get in touch with the doctors on our Rhodeshow.com page.